Welcome to Ortho Reports. Sometimes the most fascinating stories in medicine play out just like a detective novel. And today, we're diving into a case that is part mystery, part investigation, and 100% true. It all started with a question that, at first, just didn't seem to make any sense.
It really all boils down to this one single baffling question. How can a really serious problem, something showing up in your arm,
actually be the work of a silent culprit hiding out somewhere completely different, like in your neck? This was the central puzzle that a team of medical detectives had to piece together.
All right, so let's set the scene. Our story begins, like so many do, in a hospital, with a patient who's in pain and a whole bunch of clues that aren't adding up.
So, a woman in her 70s walks into the hospital. For about 5 months, she's had this growing pain and swelling in her right arm. But here's the thing, it's not just the pain, it's the whole picture. The pain started slow, but then just took off, getting worse really fast. Plus, she'd been losing weight and had no appetite. Now, those are classic red flags in medicine that tell you something bigger, something systemic might be going on. It's probably not a simple injury.
So, first things first, they take an X-ray, and the results are, well, they're alarming. The radiologist's report uses this incredibly vivid and kind of scary language, an expansile lytic lesion with a moth-eaten appearance. Yeah, you heard that right. And let me tell you, in medicine, words like moth-eaten are never, ever a good sign. It paints a picture of something just aggressively chewing away at the bone from the inside.
So, what in the world is a lytic lesion? Well, put simply, it's a hole in the bone. It's an area where healthy bone tissue has been totally destroyed, literally eaten away, and it's usually the work of a really aggressive tumor. That moth-eaten part means it isn't a nice, clean hole. Nope, it's a messy, scattered pattern of destruction. The puzzle just got a whole lot more serious.
Okay, so with this suspicious lesion now on their radar, the investigation kicks into high gear. The doctors know something is very wrong in the arm, but the million-dollar question is, did it start there, or did it travel there from somewhere else?
This process is called a metastatic workup. You can think of it as an all-out search for the primary source. The detectives bring out all their best tools. First, they order high-resolution CT scans of the patient's torso. Then, they go for a full-body PET scan to hunt for any other suspicious activity. And finally, the most important step of all, a biopsy, where they actually take a tiny piece of the lesion to examine it under a microscope.
And boom, right away the CT scan turns up a huge lead. But here's the twist. It's not where they were looking. The scan flags a suspicious little mass in the right lobe of her thyroid gland, in her neck. All of a sudden, the investigation has a second crime scene. This is the big moment, right? The pivotal question of the whole investigation. Are these two totally separate problems? Or is the spot in the thyroid the hidden culprit behind all the destruction happening in the arm? To find out, they really needed to see the whole picture at once.
And this is where the PET scan comes in. It's a fantastic tool for this kind of detective work. See, it uses a special kind of radioactive sugar, and cancer cells, they are incredibly hungry and active, so they just gobble this stuff up. This makes them light up like little light bulbs on the scan, showing doctors exactly where the most active disease is, anywhere in the body.
And there it is, the aha moment. The PET scan lights up in two key places. First, the obvious spot in the arm. No big surprise there. But then it also lights up that small, previously hidden mass in her thyroid. This is the smoking gun. It visually confirms that the two crime scenes are, in fact, connected.
So, with that connection pretty much confirmed, it was time for the final reveal, to unmask the true identity of this disease.
The culprit actually has a name. It's called an occult primary malignancy. Occult is just a fancy word for hidden. This is a type of cancer that is so incredibly sneaky that it causes zero symptoms at its home base. It stays completely silent, only announcing its presence when it sends out cells to cause trouble in a totally different part of the body.
In that biopsy from the arm bone, it provided the final, absolute proof. When the pathologists looked at the cells under the microscope, they didn't see bone cancer cells. They saw thyroid cancer cells. The diagnosis was now crystal clear. Metastatic papillary thyroid carcinoma. The cancer didn't start in her arm. It was a traveler, a metastasis, that came from that silent tumor in her thyroid.
So it's a fascinating detective story for sure, a real medical whodunit. But what's the bigger lesson here? Why does this one unique case matter to the wider world of medicine?
It matters because of this number. The odds of this exact scenario happening are, well, they're incredibly low. For a hidden thyroid cancer to first reveal itself as a metastasis in an arm or a leg bone is estimated to happen in less than 1% of cases. It's just exceedingly rare.
Now, to put that into perspective for you, when thyroid cancer does spread to the bone, it almost always goes to what we call the axial skeleton. That's the core of your body. Think spine, skull, pelvis. For it to skip all of those common spots and instead just show up way out in the limb, the appendicular skeleton, is what makes this case such a standout in the medical literature.
And that brings us to the big official takeaway from the doctors who wrote this report. It's a really powerful reminder. When an older patient shows up with a suspicious lesion in a bone, you can't just get tunnel vision and focus on that one spot. You absolutely have to do a comprehensive whole-body search to figure out if it's a primary bone tumor or if it's a metastasis from a hidden cancer somewhere else entirely.
And what about our patient, the center of our story? Well, given her age and overall health, the goal of her treatment was palliative, which means it was focused on comfort and quality of life. She received radiation therapy on her arm, and it worked. It successfully relieved her pain, helped heal the bone, and really improved her quality of life. So, a positive outcome to a very complex case.
And that leaves us with one final thought. This case is the perfect example of that old saying in medicine. When you hear hoofbeats, think of horses, but don't forget about zebras. The painful arm? That was the horse, the obvious problem right in front of you. But the real answer, the solution, lay with the zebra, that rare, unexpected diagnosis hiding in plain sight. It really makes you wonder, doesn't it? How many other mysteries are out there just waiting to be solved by looking beyond the obvious? Thanks for tuning in.